Yeah, thank you very much. Can you hear me and see me?
Yes, sir. We can hear and see you, and we have also given the rights to share the screen.
Sure. So at the very outset, my sincere thanks to the team ILBS, Professor Sareen, Professor Kapil, Dr. Archana, and also to the Ministry of Health and Family Welfare and all the participating aims to this very important webinar and to all the distinguished directors and executives of about the association of NAFLD with various non-communicable diseases, diabetes, hypertension, dyslipidemia, cardiovascular, and CKD. I think a lot has been said about all this by the previous speakers. So what I will do is in the next 15-20 minutes, maybe show you some data related to this association, maybe some a bit of pathophysiology, and what is the clinical relevance for public health point of view and as hepatologists for us. So when we talk about NAFLD and metabolic syndrome, we have understood till now that they are very closely associated. To the fact, I think Dr. Surekha showed you a slide that NAFLD is now considered as a hepatic component of metabolic syndrome. The second thing what we need to understand is when we say that this what is known as a bidirectional link between NAFLD and metabolic syndrome. When we say bidirectional link, what does it mean? It means that patients, those who have metabolic risk factors or a full-blown metabolic syndrome, obviously they are at a higher risk of having NAFLD or fatty liver disease. But on the other hand, if you just have fatty liver to begin with, no metabolic risk factors, which means no diabetes, no hypertension, nothing, over a period of time, these patients are at a higher risk of developing metabolic syndrome and its components. So I'll show you the data on both these things. The third important, component is that these metabolic risk factors, we know that NAFLD is a spectrum. You heard a very elegant talk by Professor Sareen. You could have just fat in the liver, so-called NAFL, and some of these patients can progress on to a severe form of fatty liver called NASH. And NASH can be with or without fibrosis. And then some of these patients can progress on to cirrhosis and liver cancer. Now, what are the determinants of this progression? Who are the patients who are at a risk of having severe disease? So metabolic risk factors or metabolic syndrome are very important determinants of severity of fatty liver disease. So I'll show you some data on that. And lastly, the job I have been given is to show you about the link between the NAFLD metabolic syndrome and the risk of cardiovascular disease and chronic kidney disease. Again, I think we understand that metabolic risk factors do put these patients at a higher risk of cardiovascular disease and chronic kidney disease. But I'll show you some data to say that NAFLD now has been shown as an independent risk factor for developing both these complications of cardiovascular disease and chronic kidney disease. So let me start with this, very large study which was done many years back, and the so-called the Rotterdam study, to tell you about the establish the fact that how metabolic syndrome or metabolic risk factors and fatty liver disease are kind of associated. So large study of around 3,000 participants, around one third having fatty liver disease. And if you look at the risk factors, and these are the odds ratio which you can see here. If you are centrally obese, which is very important component of metabolic syndrome, you probably have 5 times more risk of having fatty liver disease. So waist circumference is central obesity. If you are diabetic or impaired fasting glucose, which is more than 100, 2 times higher risk of having fatty liver disease. Similarly, if you are hypertensive, again 2 times risk. And if you have abnormal triglycerides, again I think 1.5 times this. So I think again establishing a fact that metabolic risk factors are very important determinants of fatty liver disease. I'll also keep showing you some Indian data associated with all these areas which I just said. This is our own data. One of the highest, prevalences of fatty liver disease in the country. Of in around 1,000 blood donors, 53% of them had fatty liver. And when we looked at the, risk factors in them, they were nothing but, look at this: the central obesity, overall obesity, blood pressure, cholesterol, and metabolic syndrome. They were all independent predictors of fatty liver disease. So I think this is, established beyond doubt that if you have these metabolic risk factors, your risk of having fatty liver disease actually goes, 2 to 5 times higher than the general population. Now, coming to the second part, what is the prevalence of fatty liver disease in patients, those who have these metabolic risk factors? And we understand that this prevalence is much more than the general population. For the sake of time, what I have done is I have picked up this very recent meta-analysis, again given by the Professor Zubair Yunusi's group, where they looked at 80 studies from 20 different countries, around 50,000 patients with diabetes. I think one of the largest data. And look at this: the global prevalence of fatty liver amongst the patients with diabetes was around 56%, which we know is the global prevalence of fatty liver is taken as usually around 25%, a variable figures, as I said, but then in diabetics I think this was shown as 56%. I will discuss this further, but then the same meta-analysis also showed that patients, those who had diabetes, were at a higher risk of having NASH and advanced fibrosis, which I said in the beginning, that patients, those who have metabolic risk factors, diabetes, hypertension, or any other metabolic risk factors, and not at higher risk of having the fatty liver disease, but also the severe form of fatty liver disease, which means NASH and advanced fibrosis. No, again, as I said, I'll keep showing you some Indian data. So this is, again, many years back, this is a study from Dr. V. Mohan's group down south in Chennai, where they took again, around 500 patients, subjects, I would say. And then I think 1/3 of them had diabetes, but then they looked at the prevalence of NAFLD in those with diabetes and without diabetes. Again, in diabetes, it was close to 55%, whereas those with normal glucose tolerance, it was 22%. Again, pre-diabetics also had a little higher prevalence. So I think, this, as I said, increases your risk of, having fatty liver disease as the metabolic risk factors, tend to accumulate. Now, there's another aspect which I'd like to discuss. Now, suppose you have metabolic risk factors, but then there is no fatty liver disease. Somebody could be obese, could be diabetic. I mean, obviously, the fatty liver disease is not 100%. So now what happens to them over a period of time? Very elegant study, again of around 15,000 patients and a very long follow-up. And what they found, in the beginning, there was no fatty liver. But then when they followed up these patients, look at this: 25% of them developed fatty liver. And when they looked at what is the hazard ratio, what was the risk of having fatty liver disease, this was all related to the metabolic syndrome components. And your risk of having the fatty liver went up as the number of metabolic syndrome components increased. With one component, it was say 1.92 or 2 times. With two components, it was around 2.5 times, and with three components, it went up to 3.5 times. So again, thereby saying that as the number of components of metabolic syndrome go up, your risk of having NAFLD really goes up. Now coming to the third aspect of this is again very important, as especially for us hepatologists. I think our liver clinics, pre-COVID era used to be flooded with patients with all kinds of liver diseases, but then NAFLD is a kind of, I would say, another pandemic. So this is our recent data, which is what we call our consortium in India, which is known as an Indian Consortium on Non-Alcoholic Fatty Liver Disease. And we have 40 centers from the country, participating in this consortium. And we are collecting the real life electronic data capture. This is all online collection. And we had presented in the APASL meeting this year the interim analysis of this 4,000 patients of NAFLD, which, as I said, were collected over multiple centers from country. And my aim here is to show you that if you look at this data on the metabolic risk factors, which was available in around 3,500 patients, at least one risk factor was present in 93% of these patients. And when we looked at the metabolic syndrome, which is defined as 3 or more metabolic risk factors as per the ATP3 criteria, it was seen in 43%. And if you look at the various kinds of metabolic risk factors in this large cohort of patients with fatty liver disease, the most important was the central obesity in 83%. But then you look at hypertriglyceridemia, diabetes, HDL, hypertension, variable prevalence. So I think metabolic risk factors constitute a major. But then look at this. The diabetes prevalence here was only 18% in the beginning, which means, and again, hypertriglyceridemia 37%, HDL abnormal is 51%, which means when the patients with fatty liver disease come to us, all of them will not have all the metabolic, abnormalities. So what happens over a period of time? Suppose you follow up these patients with fatty liver disease, what happens to them? And this was a very important study, answering that question. Again, a mean follow-up of around 13 years. What they did was they took the patients with fatty liver, compared them with the general population, and they were trying to look at the mortality risk in these patients. Patients with NASH had a higher risk of mortality. But important message I want to give from this study is that when they started this study, only 8.5% of the patients had diabetes. But then over a period of time, which as I said is the mean follow-up of is 13 years, 78% of these patients either had diabetes or impaired glucose tolerance, which means over a period of time, if you have fatty liver disease, even if you do not have metabolic risk factors to begin with, over a period of time, these patients tend to develop diabetes, tend to develop, various other metabolic risk factors. So there are, again, time doesn't permit me to get into the details, but there are a large number of studies where people have looked into so-called the incident, diabetes in patients with fatty liver disease over a period of time. 7 years, 10 years down the line. So fatty liver disease per se has become a major risk factor for the development of diabetes and various other metabolic risk factors, which is applicable to hypertension, dyslipidemia, and everything. This is again a large data, compilation of the large data, where if you start with NAFLD, over a period of time, your risk of having hypertension, your risk of having dyslipidemia also goes up. And this is basically just trying to tell you about the bidirectional link, which I said that if you have metabolic risk factors, your risk of having fatty liver disease is high. But even if you start with fatty liver disease, your risk of having metabolic risk factors over a period of time also goes up. That's very, very important. Now coming to the another aspect, what is the bearing of these metabolic risk factors on the severity of fatty liver disease, which I said that if you have metabolic risk factors, your risk of having severe fatty liver disease. And when we say severe fatty liver disease, we mean NASH or advanced fibrosis. So that goes up if you have these metabolic risk factors. So this is again a compilation of various modalities where people have shown that if you have diabetes, you tend to have more of fatty liver disease. But then look at, these are the various modalities where people have looked at the severity of fibrosis in these patients by fibro test, NFS or NAFLD fibrosis score, or transient elastography. And again, it was shown to be the severity or the high fibrosis was shown to be higher in patients with diabetes mellitus. So now, as I said, that now you have a fatty liver disease, everybody will not progress on to have advanced fibrosis or cirrhosis or NASH. So what are the risk factors? There are various risk factors, but again, if you look at the compilation of these studies, if you see here your obesity, your diabetes, high LDL, hypertension, your insulin resistance, high central obesity, hypertension, diabetes, I think all metabolic risk factors put you at a risk of developing or at a risk of progressive NASH, what we call, or progressive fibrosis in patients with NASH. And this is a very important study from Dr. Fasia Kamal's group from Baylor's School of Medicine, US, where looked at all these metabolic risk factors. And if you look at these are the various combination of metabolic risk factors, and your risk of having cirrhosis and your risk of having HCC, liver cancer, goes up if you have all these metabolic risk factors, whether it is a combination of diabetes with hypertension and dyslipidemia, or obesity, diabetes, hypertension. So the point I'm trying to make here is that if you have metabolic risk factors, not only that you will have high chances of having fatty liver, your chances of having severe liver disease because of fatty liver, NASH, advanced fibrosis, cirrhosis, liver cancer, everything goes up. That's very, very important. Now, just briefly, I think how does, this bidirectional link, how does, we know that fatty liver disease is putting you at a risk of metabolic risk factors. Metabolic risk factors is putting you at a fatty liver. How is it happening? Again, the time doesn't permit me. But then what we need to understand is that when we talk about NAFLD, the crux or the main pathophysiology is nothing but insulin resistance. And the insulin resistance is happening at various levels. This is happening at the adipose tissue level, what we call the peripheral insulin resistance, at the skeletal muscle level, again peripheral insulin resistance, and also at the liver level. And this is what we call the hepatic insulin resistance. And hepatic insulin resistance is basically nothing, is the end result or is the after effect of fat deposition in the liver. And how the fat is getting deposited in the liver, we understand, is because of the increased delivery of these free fatty acids from the adipose tissue, or because of the de novo lipogenesis, or because of high intake of fat. So once you have fat in the liver, so normal function of the insulin is that it kinds of inhibits the glucose production in the liver and thereby maintains the glucose levels. But once the hepatic fat accumulates, I mean, there is a fat in the liver that by various molecular mechanisms, especially with the diacylglycerols and ceramides and various other molecules, leads on to hepatic insulin resistance. And because of that hepatic insulin resistance, there is impaired insulin inhibition of the glucose production. So there is increased production of glucose by the liver. So that leads on to hyperglycemia, which leads on to hyperinsulinemia, and ultimately it turns into diabetes and various other complications. So now coming to the last part of my talk about the association of NAFLD, metabolic risk factors, and its association with cardiovascular disease and chronic kidney disease. So when we talk about the various, the kinds of abnormalities which have been shown in patients with NAFLD as far as the cardiac system is concerned, I think both the structural as well as the functional abnormalities have been shown in patients with NAFLD. And when we talk about the structural abnormalities, there are studies. Again, as I said, time doesn't permit me, but there are lots of studies where people have shown that if you have NAFLD, and especially if you have a severe form of NAFLD, which is NASH or advanced fibrosis, you are at a higher risk of subclinical atherosclerosis. And people have seen that by studying what we call the carotid intima media thickness, by doing the Doppler studies of the carotid vessels. People have also looked at, the coronary artery calcifications, which has been shown to be higher in patients with fatty liver. People have looked at, the impaired flow-mediated vasodilatations, which is again a marker of atherosclerosis, arterial stiffness, aortic wall sclerosis, and the myocardial and the epicardial deposition of fat. And this myocardial and epicardial deposition of fat leads on to even abnormal metabolism in the heart and puts the patients of having cardiac arrhythmias with prolonged QTC interval and atrial fibrillation, and also causes the dysfunction, LV dysfunction and the diastolic dysfunction, sorry, and putting these patients to a higher risk of, congestive heart failure. And there are studies to say that all this can happen in patients with NAFLD independent of the other cardiovascular risk factors and other metabolic risk factors. Again, for the sake of time, I'm showing you only this one meta-analysis, which is again, large number of patients, 34,000 patients, of which 1/3 had NAFLD. And this meta-analysis clearly showed that if you have, NAFLD, these patients are at a higher risk of having both fatal and non-fatal cardiovascular events. So I think if you have fatty liver, your risk of cardiovascular events actually goes up. And Within the NAFLD, if you are diabetic, your risk of having cardiovascular events actually further goes up. So there's a kind of, synergistic effect. So NAFLD with diabetes, NAFLD without diabetes. So NAFLD with diabetes is at a higher risk of having, cardiovascular risk, cardiovascular events, may it be, myocardial infarction, cardiovascular death, ischemic stroke, everything, kind of goes up. And this is our, earlier data where we had shown this carotid intermediate thickness and, the risk of, cardiovascular mortality in these patients, which goes up. The other angle when we talk about cardiovascular disease and NAFLD is that how about patients with cardiovascular disease? What is their risk of, sorry, excuse me. What is their risk of having, fatty liver disease? So we recently again presented this data in the APASL meeting, and where we had shown that around, we took around 250 patients with cardiovascular disease, coronary artery disease, proven. And then we looked at, presence of fatty liver in them, around 40% of them had fatty liver. But when we were trying to look at, inflammation and fibrosis in them, I think the numbers were not very, very high. So moving forward to the last part about the association with chronic kidney disease, again, I have picked up this very large meta-analysis, 33 studies, 63,000 participants. And if you look at this, patients with NAFLD are at around 2 times higher risk of having so-called the prevalence of chronic kidney disease or maybe incident chronic kidney disease. And within the patients with NAFLD, if you have NASH or advanced fibrosis, your risk of having chronic kidney disease further goes up. And this is again our own data where we had looked at, 100 patients with NAFLD, and we calculated their GFR, looked at the microproteinuria in them, and we found that 30% of these patients with NAFLD actually had impaired renal function. And when we looked at the risk factors for that, other than the metabolic risk factors like diabetes, we also found that if you have a severe liver disease, which was actually seen by transient elastography or fibroscan in these patients, they were independent predictors for impaired renal function in them. So why does it happen? Again, as I said, the time doesn't permit me, but then you heard earlier that adipose tissue is expanded and inflamed in patients with fatty liver disease. There is fat in the liver. So all these two phenomena probably adds on to, insulin resistance, atherogenic dyslipidemia, inflammation, hypercoagulable kind of state, and arterial hypertension, and all this, leading on to the cardiovascular abnormalities and chronic kidney disease. And also being added is the ectopic fat deposition at the heart and at the kidney level. So clinical relevance, as I said, if you have metabolic risk factors, your chances of having severe liver disease goes up. So I think you need to be very, very careful in working these patients up for NASH and for advanced fibrosis. This is very, very important. And once you have all these risk factors, your management in these patients with antihypertensive drugs, lipid lowering drugs, weight loss strategies, and if they are diabetics, anti-diabetic drugs, I think you have to think on those lines. A lot of anti-diabetic drugs are now being used not only for the treatment of diabetes in patients with fatty liver disease, but also for the treatment of NASH per se. So I think, as I said, the time doesn't permit me to get into the details, but I think this is what is the clinical relevance of, the metabolic risk factors and NAFLD. So, ladies and gentlemen, let me summarize with what I said in the last 15-20 minutes, is that when we talk about NAFLD and metabolic risk factors, say diabetes, hypertension, dyslipidemia, or so-called metabolic syndrome, there is a bidirectional relationship. So when we say bidirectional relationship, it means that patients with NAFLD is an increased risk of NAFLD in patients, those who have metabolic syndrome or individual components of metabolic syndrome. But on the other hand, if you start with NAFLD, your risk of having, long-term risk of having diabetes and other components of metabolic syndrome, they also go up. So there is a bidirectional link. Secondly, the metabolic risk factors, they increase the severity of NAFLD, which I said, your risk of not only having fat in the liver, but your risk of having severe liver disease like NASH, advanced fibrosis also goes up if you have these metabolic risk factors. The pathogenesis, as I said, is related to the insulin resistance, which is not occurring at only the adipose tissue level, but also at the skeletal muscle level and also at the hepatic level. Finally, the relationship between fatty liver and metabolic syndrome is putting these patients at a higher risk of cardiovascular events and chronic kidney disease. And these are not only the metabolic risk factors which are causing the cardiovascular disease and chronic kidney disease in these patients. Rather, the NAFLD has now become as an independent risk factor for both cardiovascular disease and CKD. And the presence of this, CVD and the CKD would have bearing in the management of fatty liver disease, because you are not only have to manage only fatty liver in these patients, but you also have to take care of their cardiovascular disease. You also have to take care of their chronic kidney disease. And since we are talking about the prevention and control today, I think we also have to look at the strategies where you can prevent the occurrence of cardiovascular disease and the occurrence of chronic kidney disease in patients with NAFLD. So thank you very much for your kind attention, and I'll be happy to take any questions. Thank you.